This is L2 to S1 OLLIF transcambin fusion for scoliosis. As you see, patient has significant scoliosis. This is intraoperative picture, so patient is laying down in prone. When patient stands up, actually the cup angle is much worse than this. The first thing we do is the measurements from the side of the hip practically to the enter the S1 L5 S1 disc. Then I put a Jamshidi in L5 and get some bone marrow that is mixed with the tricalcium phosphate. Then we enter the disc, dilate, and here, as you see, after performing discectomy, we pack the space with tricalcium phosphate, and then we put a cage. The cage is put here in bottom one, a little to the left, a little to the right. This is intraoperative picture, so this is right, this is left. And as you see, then we put the instrumentation and Jamshidis and K-wires in L5 and S1. Then we concentrate on the levels above. Again, here you see there's significant adjustment needed to see end plates of the L4-5 because of the scoliosis. And even then, when we are concentrating on L4-5 disc, you see the double shadow of the pedicle. So we enter the disc and we want to go all the way to the other side. So we go practically very horizontal here and go all the way to the other side. You see how this is lifting little by little. We approach from the left, we go to the right. We want to put the cage to the right, so we go all the way to the right from the left. And after performing the discectomy, AP and lateral views are shown here. Then we put the cage, and the cage is put eccentrically all the way to the other side. And as you see, it completely lifts up the space. Now we put you see that when we put the cage in as well, the pedicles are adjusted better because actually the angle has changed. So now we put the Jamshidis and K-wire in L4. From each level we get 5 milliliter of bone marrow that is mixed with tricalcium phosphate for enhancement of the biologic. Then we concentrate on the 3, 4. The deflection here shows that we are in the right position. And again here as well, we want to go all the way to the other side. So we enter the disc, and as you see, not only it lifts up the space and open up the foramen, but as well, we go all the way after discectomy to the other side, to the right side, and place the cage, again eccentric to correct for scoliosis. Again, the Jamshidis are placed, and then we go to the last segment, which is L1-2 here. Again, we enter the disc base. We have to adjust it. There's significant orthopedic changes that we have to fight. In a case like that, I just put a little bit of a K-wire in and then use the dilator for the action. And as you see, it lifts up the space. And again, here, after a proper discectomy, we put the cage a little to the right side to correct for scoliosis. Here, you see again the action. Then at this point, obviously, we put the K-wires in. Then we use the decorticators, grind the surface of the facet, pack it with tricalcium phosphate mixed with bone marrow, and then we put sequentially screws. At this point, actually, the AP machine is out. So we are working only with the lateral machine to see the depth of the screws. After all screws are placed, 2 rods are passed on each side. We put it in and sequentially lock it in place. And this is the final picture in the AP, and this is final picture in the lateral and AP that shows us that most of the scoliosis is actually corrected. The end time of the surgery is 2:24, and I'm going to go to the beginning of the surgery. We started the surgery 12:41 S1, and the last picture for the final is done 2/23. So practically this surgery was 1 hour and 48 minutes, skin to skin.